Okay. Hi, everyone. Thanks so much for joining us today. I'm Sarose Saifon, the Director of the Women's Transition Housing and Supports Programs with BC Housing. I'm co-presenting with my BC Housing colleagues, Acting Director of Supportive Housing and Programs, Danielle Scott, and Rebecca Signer, the Manager of Research. I'm joining you today from the traditional and unceded territory of the Coast Salish people, the Musqueam, the Squamish, and the Tsleil-Waututh peoples. I'd also like to gratefully acknowledge that BC Housing works on the unceded, traditional, and ancestral homelands of hundreds of Indigenous peoples and nations across the province. Today, we are presenting on BC's COVID response for emergency shelters and women's transition housing and supports programs, responses, statistics, and stories. Since the start of the COVID-19 pandemic, BC Housing has been working with regional health authorities, municipal partners, and nonprofit shelter and housing providers to develop community-based response plans. This includes identifying locations where those who are experiencing or at risk of homelessness and women and children fleeing violence would be able to recover and self-isolate. These sites are vital to prevent the spread of COVID-19. They allow shelter and transition house providers to maintain safe distances between people in existing shelters, free up acute care beds in hospitals, and prevent crowding. Today, we'll share information about BC Housing and its partners' COVID response for emergency shelters for people experiencing homelessness and women's transition housing and supports programs, including responses on who is accessing BC's COVID response emergency shelters and the women's transition housing and supports program expansion spaces, impacts of COVID for these sectors in BC and the people they serve, and stories about challenges and lessons learned. Our agenda for today is Danielle's going to start us with an overview of BC Housing. Then we'll speak to responses, statistics, and stories for emergency shelters, and then also look at the Women's Transition Housing and Supports Programs, responses, statistics, and stories, and then outcomes for people experiencing homelessness and outcomes for women and children at risk of violence. And lastly, we'll finish with how we are using the data to inform decision-making during the pandemic. And I'll now hand it over to Danielle.
Thanks, Rose. So first, I'd like to tell you a little bit about BC Housing. So BC Housing develops and administers a wide range of housing and programs, as well as licensing residential builders and consumer protections for homeowners. We assist about 110,000 households and almost 300 communities across British Columbia. This assistance includes emergency shelter and homeless outreach programs, transition houses, safe homes, and second stage programs for women and children fleeing violence, independent and supportive subsidized housing, rental assistance in the private market, and home adaptations for seniors and people with disabilities, as well as first-time homeowners. So there are various ways that the province supported service providers through COVID. This included setting up expansion sites for self-isolation, quarantine, as space was needed. We have these spaces secured at the moment through March 31st, 2022. We also supplied personal protective equipment and other supplies, contactless thermometers, plexiglass, computers and phones, etc., and meals actually through the end of this year. We also provided an essential service letter for increased access to groceries, for example, with Save on Foods and Safeway here local in British Columbia. We also initiated a temporary pandemic pay and safe staffing in 2020. And there was federal support as well through wage and the BCSDH support. So for homelessness in British Columbia, to give you some context, in the 2018 report on homelessness in BC, 7,655 individuals were identified as experiencing homelessness in the province. The majority, about 2/3, were sheltered, and 1/3 were about unsheltered. And just so you know, in terms of population, this count covered over 80% of the province by population. At the start of COVID-19 pandemic, BC Housing funded approximately 5,100 emergency sheltering spaces around the province, and that's from March 31st, 2020 statistic. These spaces were funded through the year-round emergency shelter program, temporary shelters, and the extreme weather response sheltering program. These shelters are operated by our nonprofit partners across the province. So just about the emergency shelter program, they're a place for people to sleep, eat, and wash. Shelters provide some of these basic services, so a bed, meals, hygiene facilities, laundry, access to support staff, a place to secure their belongings, and the provision of harm reduction supplies. And for a bit of information around our COVID response or emergency shelters for people experiencing homelessness, as Rose mentioned earlier, BC Housing has been working with partners to identify locations where vulnerable individuals, such as those experiencing or at risk of homelessness, would be able to recover and self-isolate. COVID response emergency shelters run by nonprofit shelter providers are operating in civic spaces such as community centers and arenas, hotels leased by BC Housing in the province, and we extended temporary shelters, so those temporary shelters or extreme weather response shelters that were extended. So through this, it posed some opportunities and some challenges for the service providers. Some of the challenges, I'll start with the challenges first, were try to mitigate guests. People are social people, and if you're trying to isolate and keep people safe, that was certainly a challenge. If you needed to isolate and quarantine, but say you are a smoker, so getting outside safely and back inside, as a lot of the places were non-smoking. And also the provision of harm reduction services, so needing to address the poisoning of the drug supply in addition to the COVID-19 pandemic. And the nonprofits are really developing innovative solutions to ensure folks using alone were kept safe. The opportunities, however, it strengthened the partnerships that we have health authorities. It was unlike anything that we've seen before, and I think this is going to be a positive outcome if there are any out of the pandemic. We also had an emergency response center referral system through health authorities, so if they were releasing vulnerable individuals with the partnership through health, they were actually on site at some of these spaces. And on the photo you see here, we're calling them pods, and we were using them in larger spaces, and we'd never used them before. And what it proved is that it allows for both privacy of the individuals, but also really good sight lines for the operator to keep people safe and to do wellness checks. And I'll just pass this over to Rebecca to get into the data. Thank you.
Thanks. Thank you. So there were almost 3,000 stays at BC COVID response emergency shelters. Almost 2/3 of those stays were in the Lower Mainland. There were fewer stays in Vancouver Island and the northern regions, as until the more recent waves of COVID, they had lower case counts. These areas also have much smaller populations overall compared to the Lower Mainland. We'll move on to the next slide. So what was the uptake at the COVID response emergency shelters? Occupancy for COVID response emergency shelters increased between April and July of 2020 and remained steady at about 70% from in August and September 2020. Occupancy at COVID response emergency shelters ranged between sites, with some having low occupancy and others reaching capacity during the reporting period. Different COVID response emergency shelters had different operating models. For example, some being referral only through our health partnerships, which may have impacted occupancy. And pre-pandemic, existing shelters were operating at over 100% occupancy, so that was in 2019-20 fiscal year. By comparison, during the first 2 quarters of the pandemic, existing emergency shelters were operating at about 80% occupancy, but we would expect to see lower occupancy at the existing sites during the pandemic due to physical distancing. And occupancy at COVID response emergency shelters is not intended to reach 100%, as surge capacity is required. So what does this tell us? We are seeing lower occupancy at the existing sites due to physical distancing, which is expected, but COVID response emergency shelter spaces are making up the difference, and we have room for additional capacity at COVID response sites if needed. We'll move on to the next slide. So were COVID response emergency shelter sites being used for different reasons than existing spaces during the pandemic? And the data shows us that in fact, yes. While the majority of stays at existing shelters were because the person was experiencing housing challenges during the pandemic period, we see significantly larger proportion of stays at the COVID response emergency shelters for medical reasons or because the person was referred to the shelter by another shelter or service. COVID response emergency shelters have different operating models, but many were set up to provide spaces for people to self-isolate or quarantine, And looking at medical reasons as a reason for referral, it seems the COVID response emergency shelters are being used for these purposes. As well, many of the COVID response emergency shelters were set up to create physical distancing for existing shelters. And with many stays due to the person being referred by another shelter or service, we see the sites were being used for physical distancing. And some COVID response emergency shelters were also set up to increase shelter capacity to give people experiencing homelessness a safe place to be in the pandemic. So we see many people are still accessing the spaces due to housing challenges. This information helps us demonstrate accountability. The COVID response emergency shelter spaces were set up with a different purpose, and it appears they are being used for that purpose compared to the existing sites. We also know that some sites are set up in partnerships with health authorities, so it makes sense that we would see more referrals for medical reasons compared to existing shelters. So next slide, please. So we also gathered data about who is accessing the COVID response shelters to see if there are any differences with those who are accessing existing shelters, and if there are any differences at both site types compared to pre-pandemic. So most stays were for men, but we see more stays at the COVID response shelters compared to existing shelters during the same reporting period and pre-pandemic. So Danielle, can you speak to why we may be seeing more women accessing the COVID response shelters compared to the existing shelters?
In speaking with the service providers, the primary piece of feedback that we received was the safety. So, with an emergency shelter, typically it's a congregate setting, bunk beds or mats on floors, not a lot of division spaces between, the different shelter guests. And so the feedback that we were getting is that it was about safety, particularly for women who had children. Another piece of feedback that we got as well is that we saw they were seeing more youth accessing the shelters, and hypothesizing is those are two populations that we typically see as hidden homeless, so couch surfing, that type of thing. And because of the safety of having your own unit or room for yourself, that's why we think that we were seeing an increase in those two populations.
And was there perhaps less access to couch surfing during the pandemic, with maybe people less willing to take someone into their home?
That's another piece of feedback, thank you, that we received as well, is that through COVID, some people were losing employment, coming back home, less accessibility, and also a concern about having additional people around and a fear of contracting COVID. So that is, Rebecca, another piece that we had heard from providers about the less accessible ability to be couch surfing, and so therefore an increase in the hotels and motels that we were leasing.
Mm-hmm. Thanks. Okay, let's move on to the next slide. So for almost 1/3 of stays at expansion spaces, the person identified as being of Indigenous descent. And this is a lower proportion compared to regular shelters during the same reporting period and compared to regular shelters pre-pandemic. So Danielle, do you want to speak to this finding?
This was interesting for us, and we're hypothesizing that it was because of the locations of the hotels and motels and even civic centers that we were able to secure. The majority of them were in the lower mainland versus in the outer regions, where we do see an increased population of Indigenous peoples. So there could be any number of reasons, but that's the feedback that we've received to date. I would like to see some further analysis into that, if we can further explain why we were seeing those findings.
Mm-hmm. Okay, and so let's move on to the next slide. Thanks. So now looking at age groups, almost a quarter of stays were for people aged 55 plus at the COVID response sites, similar to existing sites during the same period, but a smaller proportion compared to pre-pandemic. And about 10% of were youth under the age of 25 years at the COVID response shelters. And like Danielle mentioned earlier, this is a higher proportion of youth compared to existing shelters during the same time period and compared to pre-pandemic. So Danielle, I think you've already spoken to why we're potentially seeing more youth at the COVID response shelters. Do you have anything you want to add on that?
No, I think that's good. I mean, that's really the feedback that we were getting from our nonprofit providers. We do know that the Ministry of MCFD, the Families and getting the name of the ministry wrong, but they did extend youth agreements. So those folks who were in care or on a youth agreement, they did extend them. So that would be one thing that we were looking at that would not account for why we were seeing an increase in youth.
Mm-hmm. Okay, so let's move on to the next slide. And so health needs are also important to consider. Almost 3/4 of stays at COVID response emergency shelters were reported to be for someone who had an addiction issue, and almost 2/3 were for someone with a mental health issue. About 1/3 of stays were for someone who reported to have a medical or physical health issue. So this is an optional question. Nonprofits operating COVID response shelters were actually asked to complete this data, but this data is not well completed for comparison to existing shelters or to pre-pandemic, just because it is optional for them to fill in. Again, we need to keep in mind when interpreting this data that some COVID response shelters were operating in partnership with health authorities and were receiving referrals for health reasons, which could increase the proportion of people with who are reporting health issues. But this indicator also demonstrates the health needs of clients accessing the COVID response shelters, which can be informative for design or for the services that need to be provided on site and referrals to community services. So let's move on to the next slide. And I'll hand it over to Saros to talk about the Women's Transition Housing and Supports Program.
Thanks, Rebecca. I'm going to provide an overview of the Women's Transition Housing and Supports Program, share some information about our COVID response, and then I'll hand it back over to Rebecca to share some stats regarding who access the programs, the impacts, and outcomes. So BC Housing provides supports to the Women's Transition Housing and Supports programs, which includes the transition houses, safe homes, second stage housing, and more recently, the long-term housing programs for women with or without children who've experienced violence or are at risk of experiencing violence. So the programs provide core services, which include safe shelter and housing, support services, safety planning, referrals, and assisting women in planning their next steps. Here's a bit of a provincial overview. We have over 115 programs across the province. You can see that majority of those programs are transition house programs with 67. And then we have 24 safe home programs, 22 second stage, and just 2 long-term housing programs. And that's over 1,000 spaces, and that includes beds and units. So just over 780 transition house beds, almost 200 second stage units, 24 safe home programs, and 20 long-term housing units. Our annual budget this last year is approximately $49 million. We're working with 80 nonprofits province-wide in 77 different communities. In 2018, the Building BC Women's Transition Housing Fund was announced, and that's a new investment of $734 million over the next 10 years to create 1,500 new spaces. And so to date, we have 26 new projects that have been announced. Just a little bit more about the different program types. So as I mentioned earlier, the transition houses are the bulk of the programs. They provide support services and safe shelter, typically for 30 days, although stays have been extended prior to COVID, but certainly during COVID as well, we're seeing that stays have been longer than 30 days in some cases. And transition houses are often communal living settings. They are staffed 24/7, and meals and immediate basic needs are provided, such as laundry, personal hygiene supplies, etc. And then there's the safe home programs. So the safe home programs are primarily in rural and remote communities. They provide support services and safe short-term shelter, so typically only for about 10 days. And the shelter piece of the safe homes can look a little bit different. So definitely prior to COVID, there were some safe homes that were still operating out of private homes. So that would be individuals, families in the community that may have some additional space that they could offer to a woman or a family in crisis. And certainly since COVID, we've moved away to utilizing more hotel and motels. But over the last few years as well, we've also moved to having more permanent spaces, such as a rental apartment, or even having more permanent spaces, such as a unit within a social housing development. And then there's lastly our second stage housing, which provides safe, affordable short-term housing with some support services as well. And women and families would often access a second stage program through a transition house or safe home. And they're often assisting women in planning their next steps. And usually the stays are anywhere from 6 to 18 months. And just the next slide, please. And so for the COVID expansion sites or the temporary spaces that were set up around the province to support the physical distancing that was required, again, particularly for the transition houses that are operating in communal settings, but also some safe homes and second stage programs that operate that way as well. So really set up primarily to support that physical distancing, to support self-isolation, quarantine for those who may be symptomatic or COVID positive, also for those who may have compromised health and could be at greater risk being in a communal living setting. And these additional spaces were also utilized if the current programs were full or at capacity, because many of them did need to reduce their capacity. And at the start of the pandemic, back in the spring of 2020, we had close to 300 spaces. And as of March 31st of this year, we had close to 115 spaces. The next slide. And some of the impacts of COVID on these programs. So we have certainly seen an increase in violence, and some of this has been reported by different police departments as well, but certainly by the programs that we support, and also an increased severity of violence. So many programs have reported that women are staying longer in abusive and violent situations, and therefore, once they are reaching out to the programs, they often are have experienced a fair bit of harm and injuries. And access to services was particularly challenging at the start of the pandemic. So with the stay-at-home orders, it was very unclear if these programs were even open and available to women. It was very difficult for women to even access any supports as so many services closed, schools closed. So just ways that they would have been referred, they couldn't be referred in those ways as they were staying at home. And so that was certainly hindered that access to service. And then programs just really needing to adapt their services and sites quite significantly with the pandemic. So just with respect even to access to service, many of the programs, traditionally are accessed by women making a telephone call or being referred by another service provider. And with that not happening in the same ways, many service providers really took to social media, to the media, their local media as well, to just make it known that the programs are open. They also really adapted some of their services in terms of being more available on social media, so women could chat if they might not be able to talk on the phone because they're staying at home. They can send an email, they could text, just finding different ways for them to access the programs. And it certainly also helped when our provincial health officer was able to message that it's okay to leave your home if you're not safe. And many of the sites also having to make adaptations, and I'll speak to this a little bit more later in the presentation. And staffing challenges have been significant as well, not just for this sector, but also for the homelessness serving sector as well. So staff who may also be symptomatic and unable to come into work, or COVID positive, or have compromised health, and just seeing a real significant turnover in staffing. And the next slide, please. And some other challenges that we saw. So certainly pre-COVID and ongoing, we know that there's always been a challenge with respect to having sufficient spaces when they're needed for women and children. And staffing challenges were certainly present pre-COVID as well. And then with COVID and the setup of the expansion sites, we certainly did see some safety and security issues. So obviously, the level of safety and security at the hotel is not comparable to what we're able to provide at the transition house with the 24/7 staffing and all the different safety features that are in place. So that was certainly challenging for many of the programs. And then, as I mentioned earlier, just that communal living environment. So, definitely a fear of contracting COVID by being in that type of setting for the residents, also for the staff as well. and just managing lots of different protocols, COVID safety protocols, whether around cleaning and just around interactions between staff and residents and amongst staff. Pets was also proved to be a bit challenging. We have several programs that do accept pets into their programs, and challenging to find hotels that would also accept pets. And then also around accommodating children, so really looking for those family-friendly hotels. And I'll speak to this a little bit later in the presentation as well, around some of those challenges for women with children. And really just recognizing that, you know, what the programs offer is much more than shelter and basic needs, but, you know, it's very much a home-like environment. There are supports there provided by staff, and it's the relationship building and the socialization and the support that women get from each other as well that we couldn't accomplish in the same way within the hotel setting. The next slide, I'm going to now hand it over to Rebecca to speak more to the data. Thank you.
Thanks. Thank you. So there were over 800 stays for women at the Women's Transition Housing and Supports Programs expansion sites during the fiscal year of 2020-21. And there were over 3,800 stays for women at the existing sites during the same time period. And most of those stays were at the transition houses, which have the most spaces of the 3 program types. In addition to the stays for women seen here, there are over 500 stays for children at the expansion sites and over 2,300 at the existing sites. In previous years, we have seen about 10,000 stays per year for women and children, with about 7,500 total stays for women and children at the expansion sites and existing sites in the combined in 2020-21. This means that the program saw far fewer stays compared to the average for previous reporting years. So let's look at occupancy trends to dig into why we saw fewer stays a bit more. So we'll move on to the next slide. Thank you. So occupancy at expansion sites grew April to October 2020, but then was typically around 50% each month until March 2021. The numbers of spaces gets adjusted based on monthly reports and where there is additional need around the province. So some sites have been closed or some had spaces reduced, and some sites have opened since the start of the pandemic. And as Rose mentioned at the beginning, we started out with more units and more spaces, and we've reduced it over the pandemic in response to the reporting. So occupancy is not at 100%, as there is need for surge capacity. For example, if an existing transition house has a positive case, all women and children at the existing site can be moved to the expansion spaces, which are in leased hotels and therefore have self-contained rooms for each household to allow them to self-isolate or quarantine. Occupancy at existing sites was fairly consistent over the reporting months at about 50%, but this varied by program type. Occupancy was highest at second stage housing, followed by safe homes and then transition houses. And like Thoreau said, with transition houses typically having the most common living space compared to other types of programs. Occupancy at second stage housing, which has self-contained apartments for each household, remained virtually unchanged throughout the reporting months of the pandemic. Occupancy at transition houses during the pandemic reporting period was lower compared to what we've seen in previous years, usually at about 65 to 75%. We would expect to see lower occupancy at the transition houses and safe homes as expansion spaces were set up to create physical distancing at these program types, but occupancy is still lower even once stays at expansion sites are factored in, particularly in the early months of the pandemic. And this helps explain why we saw fewer stays in 2021 compared to previous reporting years. Lower stays per month, particularly in the early months of the pandemic, was a driver of those overall lower stays throughout the year. So why did stays at occupancy drop off at the beginning of the pandemic, particularly at transition houses? So like we've mentioned, transition houses have a more communal setting compared to safe homes and second stage. As the pandemic set in, though women and children would have been experiencing more violence given the stay-at-home orders, women may have been fearful about going to a communal setting in a pandemic, especially as we were learning about how the virus spread and getting access to PPE. The transition houses introduced several measures to keep women safe in the communal setting and spent some time advertising that they are in fact still open and the strategies in place to reduce the potential spread of COVID at their sites. So Saroz, you've already spoken to this a little bit, but is there anything that you want to add in terms of the strategies put in place at the transition homes to keep women and children safe during the pandemic, given that communal layout of more transition houses?
Yeah, for sure. I mean, I think definitely some other sort of modifications that a lot of our service providers were able to make to their sites to just make them safer was just even trying to really reduce some of those touch surfaces. So, some swapped out some of their lighting for motion detected lighting, touchless faucets as well were installed. They installed some physical barriers, such as plexiglass or some of the movable screens to be able to create some of that distance within the spaces. And also just really utilizing their outdoor spaces in very different ways. So, we've heard about a lot of sort of art therapy groups that were being held outdoors, lots of gardening that was happening over the summer, having moving out nights outdoors as well. So really utilizing the outdoor spaces as we knew that it was safer to be outdoors together as a group, but also just really having to schedule the use of their rooms, the TV lounge, the quiet rooms for women. So just really implementing some of those measures.
Okay, thank you. So Danielle, let's move on to the next slide. Thank you. So what has been the impact of COVID and the need for physical distancing at the Women's Transition Housing and Support Program sites? 39% of stays for women at the expansion sites were due to other existing programs being full, which means despite lower stays during the fiscal year, due to the lower capacity for physical distancing, there was a need for expansion spaces to serve as overflow spaces for existing transition houses and safe homes. An additional 40% of stays for women at expansion sites were due to the woman or a member of their household being in vulnerable health or who required self-isolation or quarantine, who could perhaps not be accommodated in their own room at the existing site due to the communal living spaces, again, particularly at the transition houses, showing the sites were not just used to accommodate overflow due to physical distancing at the existing sites, but also to provide more self-contained spaces during the pandemic compared to what is typically offered in the transition houses. So this shows the expansion sites played an important role in creating physical distancing at the existing sites and that they provided a place for those who need to self-isolate or quarantine, which can be more challenging in the communal setting of many transition houses and safe homes. So for existing sites, we asked whether women or one of the children accompanying them required their own room because they were in vulnerable health, required self-isolation or quarantine. And we found that over 1/4 of stays required their own room for these reasons. This was most commonly the case at the transition houses, again with the more communal setting, and very rarely the case at the second stage housing, which has self-contained units. So we can move on to the next slide. Thanks. So in terms of who is staying at the sites, about 70% of women at the expansion sites and existing sites were between the ages of 25 and 49 years old. Though when looking at the age groups by program type for existing sites, we are seeing a higher proportion of women 50+ years at safe homes compared to transition houses and second stage housing. So Saroz, do you want to speak to why we're seeing older women coming in for assistance, particularly during the pandemic?
Sure. So we do have some safe home programs that are specifically for older women, and those are located in the interior and island regions of the province and in a couple of transition houses in the lower mainland specifically for older women. So some of these programs were certainly reporting that they were seeing more older women coming forward during this time, and women who'd resided in their communities for a long time, but have actually never accessed their services before, but were accessing them during the pandemic.
Thank you. So let's move on to the next slide. So over 1/3 of stays for women identified as being of Indigenous descent at expansion sites. A higher proportion of stays at existing sites were for women who identified as being of Indigenous descent, driven by the transition houses. This is because some existing transition houses specifically serve women of Indigenous descent, and most expansion sites are in the lower mainland, which has a lower proportion of stays for women who identified as being of Indigenous descent. We can move on to the next slide. and we'll talk about children. So about 1/3 of stays for women who were accompanied by children at both the expansion and the existing sites. But this varied by program type, especially among the existing sites. So women at safe homes were less likely to be accompanied by children, while women at second stage programs were much more likely to be accompanied by children. So Saroz, do you want to speak to this finding?
Yeah, so I mean, as we mentioned earlier, some of the safe homes are specifically for older women, so they may not have dependent children with them when they're accessing the programs. They often don't. Also, many of the safe homes are in rural and remote communities as well, primarily in the interior northern part of the province. And some of the sites also aren't particularly well suited for children. Again, as mentioned earlier, some of them are still using a hotel or motel as a way to provide a safe space for women and children to access. And then our second stage programs are largely include family size units. So not many of the second stage programs actually have studio or one bedroom units. So they're largely serving women with children, serving families.
Thanks. And would you like to speak to some of the challenges in accommodating children in the hotel spaces that were used as expansion spaces and some of the mitigation strategies used?
Mm-hmm. So yes, I mean, certainly when we first secured those additional spaces in the hotels, we were very clear that, this is a program that supports women and women with children, and therefore really looking for some of those family-friendly hotels, looking for hotels that may have suites, kitchenettes as well, so it would be easier for families to be able to reside there. And that was challenging at times to be able to find hotels that had those type of spaces. It was also quite challenging in that, the hotel is very much a room, and not having access to that outdoor space. And again, not having access to staff in the same way because they're not there on a 24/7 basis. And also not being able to interact again with other residents, other women and children in the same way if they were staying at the transition house. So some ways that we were able to mitigate this was, definitely trying to find those sites that would have, or those hotel sites that would have the kitchenettes, that have the suites, but also the programs were also really trying to ensure that if there were families that they do their best to accommodate them within the transition house program, and that, some of the women without children may be better suited to staying at the hotels, just so families could be at the transition house, have access to staff on that 24/7 basis, have access to the outdoor spaces, and be able to interact with each other as well.
Thanks. So the majority of children were under the age of 12 years at both site types, and this information is of importance in terms of design. So most children staying at the programs are younger children who would require some safe indoor and outdoor play spaces versus study spaces that maybe would be more required by older children, especially when taking classes online during COVID. So let's move on to the next slide. So about half of women accompanied by children were accompanied by one child at both expansion and existing sites, but we were also seeing larger families of 3 or more children, which has impacts in terms of design of existing sites and has challenges in terms of accommodating children at expansion sites. For example, at the expansion sites, a larger family may need to spread out across more than one room, and it could be difficult to provide study space or play space for larger families in the hotel space. So we also asked if children were staying full or part-time. The vast majority of children stayed full-time rather than part-time at both site types. We gathered this information as we wanted to know if children were coming and going from the existing and expansion spaces, as this would have an impact on potential exposure to COVID from children moving back and forth between households during the women's stay. So upon next slide. So upon departure from expansion sites, most went to housing and second stage, other shelters and services, or friends and family. But about 1/10 returned to the abusive situation or left to homelessness. We see fairly similar results for the existing sites. We do see a higher proportion of women leaving expansion sites to other transition houses and services compared to existing sites, which suggests that women are staying at expansion sites until spaces open up at the existing transition houses or other services. So also of note, a much more significant proportion of women leaving second stage housing go to housing compared to other program types, which is consistent with what we've seen pre-pandemic as well. So Rose, did the pandemic have an impact for providers in terms of assisting women to find long-term housing?
Yes, I mean, it certainly did. We've certainly heard from several of our service providers that, I mean, finding long-term, safe, affordable housing has always been a challenge, but particularly during the pandemic. So just the availability of rental housing in the private market became quite difficult. Just being able to sort of facilitate the viewings for any of those spaces was also much more challenging. Where typically some of our service providers would assist with transportation or even attend the viewing as well. That wasn't always possible or permitted to have that many people sort of attending. So those were definitely some challenges. And also with respect to accessing social housing, just not seeing the same level of sort of vacancies coming available. So women really struggling in terms of finding spaces to move on to after these programs.
Thank you. So Danielle, we'll move on to the next slide. So now that we've learned about the COVID response emergency shelters and the women's transition housing and support sectors, what have been the outcomes for people experiencing homelessness and for women and children at risk of violence? The COVID response emergency shelters have served over 2,500 unique individuals, providing them with a safe space during the pandemic. At least 20% of completed stays at the COVID response emergency shelters went on to housing upon departure. And BC Housing has purchased some of the originally leased hotels that were purchased as COVID response spaces and converted these hotels to supportive housing, providing over 500 new supportive housing spaces in the province with 24/7 on-site support operated by nonprofit housing providers. We'll move on to the next slide, and we can talk about the outcomes for the Women's Transition Housing and Supports Program. So for women and children at risk of violence, despite challenges that may have arisen in providing services and assistance to women due to the pandemic, these programs continue to provide important assistance to women beyond immediate shelter, helping women find long-term housing, navigate community services, and develop safety plans. Since the start of the pandemic, over 1,100 stays for women at the Women's Transition Housing and Supports programs, both existing and expansion spaces, left to housing and second stage housing during 2020-21. WTHSP existing and expansion sites also provided about 37,000 safety plans and 35,000 referrals to community services, including to women who did not stay at the sites during the reporting period, but instead, like Sarose said earlier, maybe just called or emailed in for assistance. So Sarose, can you speak to some of the challenges that the providers encountered in providing supports to women staying in expansion spaces?
Yeah, it was certainly challenging for many of the providers because not only were they managing their existing programs, which may be one or several programs, but then also managing the expansion space as well, and the women and the families staying there. So even just that movement of sort of moving physically from location to location was certainly challenging. They also found it really challenging just not being able to be there for women, like physically on a 24/7 basis. And some of the other challenges that were encountered as well were just with respect to safety and security. So it was challenging in that, they're in the hotel setting. There's also the public members that are staying there as well. So they couldn't necessarily provide that safety and security in the same way that they would in the transition house setting, which was another challenge for them.
Mm-hmm. Okay, and can you tell us about challenges encountered in connecting women and children to support services during the pandemic, especially at the beginning when maybe services weren't as accessible?
Yeah, and I think we've spoken about this a little bit already. Just yeah, it was very challenging in the early days of the pandemic. So again, just not even knowing if services were available, and if these programs were even open and accepting women. So that was a big challenge. And so lots of work was done with respect to messaging on the part of BC Housing, the province, but all of our service providers too, messaging sort of within their local communities that yes, they are available, and really making themselves known, whether that was through social media, and also just different channels kind of like within their communities to ensure that everybody was aware that those services are available to women and children. And then I think just early days too, just not knowing about, just all the different different requirements, what was required, what did they need to do. So just setting up all those COVID safety protocols, the screening protocols as well, just needing to really ask about women having symptoms, and then also trying to find spaces like within their existing programs to help support someone who may need to self-isolate and symptomatic. That was actually one of the other challenges with the expansion spaces that we heard that many of the programs struggled or felt uncomfortable at times moving women to an expansion space if they were symptomatic and they were ill. So that was difficult to do, but they weren't always able to support them within the transitional setting.
Thank you. So we'll move on to the next slide. So why are we collecting this information about our COVID response emergency shelters and our women's transition housing and supports programs expansion sites? We're collecting this information because it's important to demonstrate accountability to the public and government funders for how we're using taxpayer funding, particularly when it comes to the investment in COVID response expansion spaces. The data also helps us understand if we need to grow the program and how to address unmet needs. For example, we use this data to better understand, are the spaces needed? Do we need more spaces in some locations? Do we need spaces that serve women staying on their own or women with children? And are the children young children requiring play spaces or older children requiring study spaces? And what are the impacts of the programs? So we use this data to inform pandemic decision making for the current situation, and we can also use it for planning for future pandemics and other emergencies. We need a way to understand any impacts of COVID on the sector during the pandemic. So did stays go up or down? Could people who need to self-isolate or quarantine be accommodated? Who is using the spaces? Where children staying full-time or part-time? We also want to look at the impact of the programs on the pandemic. So were women fleeing violence still connected to services? Same for people experiencing homelessness, even as some in-person services were reduced due to the pandemic. And were women fleeing violence and people experiencing homelessness still connected to housing when accessing emergency shelters and the women's transition housing and supports programs during the pandemic? So we'll move on to the next slide, and Rose, I'll turn it over to you.
Okay, thank you. So how can we use this data and how have we been using it? So the data has been used widely across the organization and has had impact on operations, development, and policy decisions, as well as been important for demonstrating accountability. So the data has helped us understand the need for the expansion spaces, as well as demonstrate that need through evidence-based information. It's also helped us make decisions about how many spaces or sites are needed and then justify that need to finance in our Treasury Board. And the data has been used since the onset of the pandemic to make adjustments to spaces as needed throughout the province. So we've also been able to use the data to make funding requests, and that may include funding requests for increased staffing for sites that are seeing a high occupancy. It's also helped us to report back to the public and to demonstrate that accountability about occupancy at sites, to show BC Housing's response to the pandemic. Where are we supporting the need for these spaces, additional spaces, and demonstrating accountability for the financial investments associated with these additional sites and spaces. The data has also allowed us to have evidence-based discussions with our service providers when changes need to be made to the sites we have in place or some of the spaces, so we can better accommodate the needs around the province for those that are accessing these services and these sites, rather than relying solely on anecdotal information and evidence. And we are collecting outcome data so we can tell the story of the impact of BC Housing's COVID response. And lastly, we can use this data to see the successes and challenges to inform program and policy changes. And the next slide, please.
Danielle, do you want to wrap us up?
Just thank everyone for joining us today. Would like to highlight a couple. We put some links in the presentation. One is looking at our research center and also our research newsletter. So if you're interested in those things, I believe the presentation will be shared with you. If not, please contact us and we'll be sure to share the information with you. Thank you so much for joining us today. We really appreciate it. Thank you.
Thank you.
Thank you.